So should we wait for a upgraded vaccine? Is that what you're suggesting, that there's no urgency to go in for a booster?
Yes, so if you've already taken a booster, there's no urgency to take another booster. But I think we should also do good quality research to see what is the current status of the efficacy of the current vaccines, and do we need to develop a new vaccine which covers the circulating strain and is more effective and would be more useful as we do for influenza every year.
So is the vaccine plus natural immunity strong enough, doctor? The fact that I've taken 2 doses, I took my booster, natural immunity now strong enough?
So what it seems likely in India is that a large number of people have had the vaccine, and along with that they have got natural immunity because a large number of people have had exposure to Omicron or other variants of COVID, and therefore the combination of natural infection along with the vaccine possibly gives you a good long-lasting immunity, and that's why I think we are in a little better position than, let's say, countries like China.
Okay, that's reassuring. Since you're speaking on China, your sense, doctor, is what we are seeing at the moment China specific? What we've seen happening in the last couple of weeks, this surge in China, is it very China specific? Therefore, we in India are relatively protected, insulated.
So I think that this is China specific, and for 3 broad reasons. One is China focused on a zero COVID policy. What that meant was that they did not allow the virus to spread. Even if they had a few cases that had mild COVID, they would clamp down and have a very aggressive lockdown. So that was good in the early days, but what it really led to subsequently was that you had a large part of your population which was never exposed to the virus and in a way was naive to the virus, and you had no antibodies against the virus, even if the virus had the chance of causing mild infection. Secondly, we are not, a large number of the population there has not got the vaccine. The data suggests that even the older age group, the vaccine uptake has been low, and even in people with comorbidities. So that is another factor which is a problem as far as China is concerned. And thirdly, since it's a locally made vaccine which has not been evaluated at an international platform, we are not sure what is the efficacy of the vaccine. So if we combine all of these 3 factors, along with the fact that you have a new variant, BF.7, which is more infectious and spreads rapidly, then this is what is happening in China. You have a population which has not been exposed to the virus. You have a variant which is spreading very rapidly, and this is leading to a large number of cases. And as the cases spread to people who are whose immunity is compromised or who are elderly, then that can lead to more hospitalizations.
Let's come back again for a moment to vaccines, because the next question is, should mixing of vaccines be allowed? I took 2 doses of Covishield. Next time, should I be looking to take another vaccine? This is a question that's been asked often, even in the past.
So if we look at the data suggests that heterologous vaccination, that is when you combine or mix and match your vaccines, the immune response is better and you get a better protection as far as COVID is concerned. In the past, it was not being encouraged by many countries because you needed that many doses of the other vaccine to be available to be able to provide that to your population. So that is why most countries followed the same schedule, because that was what was available. But now there is enough vaccines available, and therefore I think it's worthwhile to consider a mix and match as far as vaccines are concerned. Those who have taken Covaxin or Covishield could take the Cobravax vaccine, or you could also mix and match as far as Covishield or Covaxin is concerned. The data does suggest that it gives better immunity. Even the study from ICMR, which looked at some people who by mistake got the other shot as far as the second dose was concerned, their immune response was much better.
Are nasal vaccines the best option now? I had an epidemiologist a couple of days ago who said, nasal vaccines may be the way forward.
Yes, so nasal vaccines have multiple advantages. One is, of course, they're easy to administer to a large population, and therefore that is something which is very useful. But I think the other important advantage is that they also give mucosal immunity. So when you inject the nasal vaccine into the nose, it also causes an immune reaction and brings the antibodies at the mucosal level in the lining of the nose, and that protects you from the earliest part of the infection. It also decreases the chance of the virus replicating there and causing spreading more rapidly to others. So in the long run, a nasal vaccine which is good, which is shown to be efficacious and safe, may be something which may be better and more useful, but you have to be able to show that data that this is an efficacious and safe vaccine. It would therefore be something that would be the future.